I pledge allegiance to the flag
of the
of the United States of America, to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks. I was able to review the minutes. Alex, you do a great job. I'm greatly appreciative. And is there anybody else who saw them and would like to make any changes or a motion to approve?
I actually need to make one correction to my own minutes, which is that I use the same form every week and I forgot to change the date on it. So it has October's date on it. But other than that.
You have a great eye for editing. It's unbelievable the minutia that you pick up when you read something. I don't. So with the amendment as
well, we can't approve them this week anyway, actually. That's
right.
One thing we can't do this week.
We'll have to defer that to our next meeting.
Have a fifth unless somebody else.
But no other comments regarding minutes, correct?
But then I'll just have to make a note that next month when we do it, we technically need to vote to approve 2 months worth of minutes.
Absolutely, and yeah, and make sure that everybody has a chance to weigh in, even the folks who aren't here. Okay, infectious disease follow-ups. It appears a couple things are appearing.
Sorry, David, I have organizational issues as the next agenda item. We don't have anything for that?
Yeah, I do. I have two things that I'd like to discuss in that regard. The first is to ask everybody to check the website for the actual dates of meetings. Do not fill in your calendar with the third Monday of every month, because you are less than 50% likely to hit the date right if you fill it in with the third Monday of every month. I've discussed this with Mr. White. I've discussed it with Peggy, who actually does the scheduling, and there's virtually no way around it unless we look for some completely other time. And I think as an aspiration, Monday evenings is a good aspiration, but remembering that a lot of the legal holidays are Monday holidays, that'll knock us off. That we do not have, we have tertiary dibs on the room behind the Board of Commissioners and the school district. And so changing in their schedule can put us in a challenging situation. And this month, I'm just not sure why it was that we couldn't have figured out a while ago that we would have the Board of Health tagged into because this is not a change date for the Board of Commissioners. And it felt like this came up a little late, but Peggy came up with the idea to make this a Zoom, which I thought was a really good idea. And I think Zoom as an alternative is good for all you busy people who actually have to work and go to work and get around and all of that. So just people should be aware, and we should cover it in the minutes that please check the calendar and actually use scheduled calendar dates for freeing up the time. And then the other organizational issue.
And I'll put a link to the township calendar in the minutes for everybody, but 2024 is not up yet.
Right.
But they may not post it until January 1st, but I'll put that link in there.
It's kind of like getting a doctor's appointment.
But the expectation is that it will not be the third Monday in January, because that's MLK Junior Day.
For January specifically, I can tell you it's going to be the 16th, because we had to get that cleared for the presentation. Yeah. So January, I can tell you, is going to be the 16th at the normal time, but on Tuesday.
Excellent. And then the other organizational issues next month is our election of officers. I will, after this meeting, send out the couple of paragraphs that Kevin, before he went on, I don't know whether it's sabbatical leave or whether he's gone for good, but Kevin set out about the procedure and how it should work, and people who are interested in taking leadership roles should make considerations as we will nominate and then vote at our next meeting. And then one other thing is terms, and I'll deal with that offline. Everybody is mid of term, not beginning of term, with one exception. I think it's you, Lisa, and you are eligible for a second term. All you have to do is agree to serve that second term, and I'll deal with that.
I already did that, but I can check to make sure that
I bet you did. If I had to guess. So that's all I have on organizational issues, and on infectious.
Yeah, I actually have Lisa on the January 2nd agenda.
Okay, great.
Excellent. You guys are way ahead of me.
For Board of Commissioners, yeah.
Right, no surprise. And then I'm going to be really brief on the community infectious diseases. As expected, the flu has started to progress, began in the southern tiers, and it seems to be moving upward. And it appears to be a nominally normal type of flu season with no crazy outbreaks as of yet. And it does appear that the predominant strains are supported by the current inoculation. There is nothing really clear to report on COVID. Every time a new variant appears, there's a kerfuffle among virologists and epidemiologists. My own opinion is that this is the process of endemicization, and although more infectious strains are likely to emerge, it is unlikely for a more infectious strain to be more virulent, because it will not outcompete, and that we're really seeing a settling, and that all of the ways that we measure the activity of this are flawed. There is no good continuing source of data, and even the wastewater is a little problematic because it's smoothed over large populations. Although wastewater does appear to be emerging as an epidemiologic tool for following other viruses, not just other pathogens, not just COVID. And that's all I would have to say. Maggie, anything from your side on that? You're muted. You're muted.
I don't really have much to add, except I hear a lot of anecdotal talk about COVID going up in the area.
Tons of anecdote, but I've been hearing that for now 8 weeks. It's not surprising.
So
You
I can't find any data to back it up, but
if we assume everybody has a circle of about 120 acquaintances that they have some connection to, everybody can find somebody who's got it. Usually, if they've got it, their whole family does. But the ERs are not overloaded with COVID. They're overloaded with respiratory infections, which are the expected array. PT, what do you have going on at the school district? Anything alarming there?
No, not at all. In fact, I was actually going to agree with you. I reached out to all of the nurses, and they're seeing, literally the same thing in all 5 schools: fevers, sore throats, GI issues, and a lot of upper respiratory infections, but no COVID, no flu.
And as far as I can tell, the RSV had what appeared to be an early peak, but it does not appear to be continuing to roar out of control. And there's a reappearance of a lot of things like mycoplasma and other community-acquired infections, but nothing.
I will say, based on my daily email that I got from the hospital, which is of course in Montgomery County, not Delaware County, but we're all close. The number of patients in the hospital with COVID has remained like around 10 or less than 10, at least at that particular hospital, for quite a few weeks. So it doesn't appear that hospitalizations are going up. They're kind of staying the same, even if cases are going up.
Yeah, and that actually raises a great point, because at this point, the way you said it, I think, is better than saying COVID hospitalizations. The number of people hospitalized with COVID is a more accurate descriptor of the way that cases are being acquired there, as well as fatalities. The number of people dying with COVID as opposed to COVID deaths is a better way to describe the data that we have now. So I'm going to go off that topic unless somebody else has something they want to add, and I'll turn it over to Alex for the food inspection update. Alex?
All right. First, a couple of updates for the county that I just wanted to give. So they now have there's a weekly STD/HIV clinic that is every Wednesday from 10 to 2 at their Chester office, which is 151 West 5th Street, Chester, PA, 19013. I'll put the address in the minutes. It is walk-ins only, but like I said, it's 4 hours and it is free every Wednesday. So that is something for people to be aware of. And then they have concluded their, I guess they're going to do it seasonally now, free flu clinic. That has concluded. However, they still have a bi-weekly vaccine clinic for children. That's at the Yeadon office. And again, I'll put the information for that in the minutes. They prefer that you go to their website and make an appointment for that. They do also take walk-ins, but they prefer that you make an appointment, and that's 125 Chester Ave, Yeadon, PA. So those are just two things that I wanted people to be aware of that are, because it is a full Department of Health. So those are two kind of free programs that they're running on a weekly and bi-weekly basis that are open for everybody. And then on to the restaurant inspection. So I think a bunch of months got put in because I guess they didn't get included, and they can't be put on the website until they're put into the agenda so the public can see them. But the only one that's new for this month is November. So during the month of November, the county did 46 inspections of food service establishments in Radnor. This is the highest number of inspections that the county has performed in a single month so far. We had one follow-up this month, and that did not require an additional follow-up, so that's actually pretty good overall. I'm continuing to beat the drum on this one. We had 8 establishments that got dinged for not having a certified food protection manager present when they came to do the inspection. And for 2 establishments, that was the only violation they recorded. So they would have had a perfect inspection if not for that. Again, I'll put the link in there for the programs. But that's definitely something to keep an eye on. We had 7 restaurants that had issues with sanitizer test kits, which is kind of a high amount. Basically, that is in the dishwashing area. If you go into most restaurants, you'll see 2 dishwashers. There's one that's sort of like it's kind of like a car wash on a conveyor belt, or like the conveyor belt you see with luggage at the airport, where things kind of go through and they get steamed at a high temperature. And then there's another one that's a 3-compartment sink. The one that is the 3-compartment sink, the sanitizer compartment has to be either quartz, which is ammonia, which is what most places use, bleach, which occasionally you see, but not that many places use it. And then they can also use iodine. I've never actually, in any of the ride-alongs I've done or any restaurant I've worked at, seen one that uses iodine, but they can use that. That compartment needs to have a test kit for the sanitizer solution. It needs to be stocked. It needs to be in date, and whoever's at the dishwasher when the inspector comes over to test. Well, first of all, when the inspector comes over, they're going to ask whoever the employee who's standing there to test it. The employee needs to be able to use it, and when they test it, the results need to show that it's in the acceptable range. My guess is that in a lot of cases, they're just forgetting to put out the test kits or keep them by the dishwasher, but that's because in a lot of cases it's automated. So there's a button they can hit where it will automatically put the right amount of sanitizer in as long as they fill it up to the correct line. But even if they have that kind of automated system, they still need to have the test kit there. And they're also supposed to be recording the results. So that's something that, like I said, a lot of restaurants got dinged on, but it's something I want them to be aware of. Hi, Chloe. And then one other thing I wanted to bring up, because I only saw this on one report, but if they're starting to look at it, I want business owners to be aware of it, because I happen to know that they're all doing this, which is that there was a restaurant that got dinged for an issue with bar garnishes, which was that basically somebody was using their hands to like put the lemons and limes on the drinks at the bar. They shouldn't be using their bare hands to do it. I can just tell you, every single bar I've gone into, I've never seen anybody put gloves on to do that. Really, the best way around that is to get like a mini set of tongs or something. It's one of those health violations that I think a lot of bar owners know is not really the best thing, but they skip over it because it's like an easy one to skip over. And I guess they're thinking that nobody's looking at that, but they should be aware that the county department is looking at that. And like I said, I think a lot of places are probably doing that. So that's something they may want to take a look at if they want to do better on their next inspection. And then ending on a positive note, for the second month in a row, we set a record for the number of establishments that got a perfect inspection. We had 7 this month. Hilltop Prep, the Break Room Bistro at one of the businesses, the American Legion Post, S. Clyde Weaver, Sammy's Superior Meats, Sugartown Smoked Specialties, and Rittenhouse Farms. I think those are all farmers market stands. But so we set a new record there for perfect inspections with 7 this month. And that is all I have. I don't know if anybody had any questions.
Well, I do have one point of clarification, and that is, my entire life until I heard you, I always pronounced it Yaden, but you pronounce it Yaden.
Oh, I could be wrong about that.
Okay, well, I'm pretty sure I'm not.
Okay.
just a point of clarification. Thanks an awful lot, Alex. So with that, why don't we make the change in the order of the agenda now for Maggie's sake, and do the new business, and ask Maggie and then PT to give her updates, because Maggie's got to get herself to the Board of Commissioners meeting.
That's terrific. I appreciate it. So I don't really have much to report on. A couple of follow-up issues. This Thursday evening, Parks and Rec is meeting, and on their agenda is the leash issue again. Alex, you had asked about that at the last meeting. So just if you're interested, tune in or watch it on YouTube later. I have a conflict and won't be able to go, but that's on it.
Do you happen to know off the top of your head when that meeting is?
It's at 6:30 in the Radnor Shire room.
Sorry, did you already say what it's?
What it's on Thursday at 6:30.
Thursday. Okay.
Yeah. And the full agenda is on the township website, I believe. The last Board of Commissioners meeting, and I had mentioned this before, that we had gotten a grant to get some electronic vehicles for the police department and some chargers. Well, we allowed another grant to go out. So it's a matching grant that we would have to match, but hopefully we'll get more electric vehicles for the police department. So that's another good one. And then Alex, remember Sarah Pillings had mentioned summer heat. Talking about public works, the police, people that are outdoors working for the township in the summer heat, which I thought was a really interesting point. And I did go delving in to see if there were any protocols for that. And they really do it on a case-by-case basis. If they know it's going to be a heat intense day, last summer they did call, they had public works stay home one day, or they have them come in very early and they supply them with extra fluids and then have them quit early before it gets too hot. But they don't have a set in stone protocol. So they kind of play it by ear.
So was the day off, was that the smoke or was that the heat this past summer?
Oh, that's a good question.
I just raised that question to point out it doesn't matter which.
Yeah,
we demonstrate a
when
sensitivity and
I asked
awareness.
Bill about it, he said, because I was asking specifically about heat and he brought that one day up, but I didn't ask. No, you're right. I was in Maine. I missed all that smoke, luckily. So, you would have thought it would have been worse there because it's so close to Nova Scotia, but
It's prevailing winds, not necessarily.
yeah, exactly.
straight line
It came
distance.
swooshing down rather than across.
Actually, a lot of the smoke we got came from our west instead of the north because it came following the jet stream.
Right. So that's really all I have for you today.
I will say that the leash issue will probably compete with the Kratom store issue for longevity on our
On the agenda.
on our radar. I can't imagine how that ever goes away because no matter how you settle it, there's going to be somebody whose nose is going to be out of joint.
Right. I think that that's exactly right. I think that it's on with the hopes that maybe Parks and Rec will come up with a recommendation for the Board of Commissioners, because otherwise it'll be a free for all at the Board of Commissioner level. You'll just get a packed room. It'll be like ice skating. You just get standing room only, people complaining. So.
All right, thanks, Maggie. So no orders of business for our board at this point, and of course you'll keep us informed. Thanks.
I shall do.
Thank you. And PT.
All right, and I'm gonna listen for another 5 minutes or so, and then I'm just gonna sign off.
Excellent. Thank you. Thanks for joining us. Thanks for all the help and support.
My pleasure.
So PT, I'll turn it over to you for your.
Oh wait, you know what? I forgot to mention the most important thing is I am a new grandmother.
Oh, congratulations.
About that last Monday. So I have a 1-week-old grandson.
Is that the first time?
First one, yeah. So I'm
baby. Your life has changed forever.
Yeah, I know, for the better though. He's the cutest little thing. So
of course he is.
Yeah.
Congratulations, Maggie. That's awesome.
Thank you.
My mother told me grandchildren are way better than children.
That's what everybody keeps telling me. You can hand them back.
Yeah, you get to send them back where they belong and spoil them and ruin them, and then bye.
Congratulations.
Thanks.
Congrats. What's the situation right now with the CBD Kratom store? Is it open?
It is open, not selling Kratom. CBD, no Delta 8 THC and no Kratom because of the ordinance.
Okay.
Anything further than that, I can't really discuss because it's in the middle of a lawsuit. So.
Got it. Okay.
Great, thanks.
And then I was just going to bring up really quickly, because I know, Maggie, you mentioned this at some prior meetings about the, I'm blanking on the name of it now, the comprehensive plan.
Yes.
Being done. So I went on and I filled out my thing for the comprehensive plan, and I did just want to bring that up for Lisa, that might be something you and Finn want to take a look at, because one of the things that's on it is you can drop a like a digital pin cushion into the map on different points and say, I think there should be, this over here, there's no sidewalk here and there ought to be. So if you're doing stuff about bikes, that might be an interactive tool to engage with.
Our concern though is that it's like being independently done. So I'm not sure if we're going to have data back. We have discussed that. We're not sure if we'll have data back before, it's time for his presentation, but certainly, yeah, that's a great option and information.
And thanks, Alex, for plugging the comprehensive plan. If anybody, if you're a Radnor resident, well, you obviously either live or work in Radnor, go on the website and fill out the survey. It's pretty open-ended, so I'm not sure what kind of data we'll get out of it, but and it will end somewhere in January, that part of it, and they're going to try to compile some information together.
Okay. PT.
All right. Maggie's got a grandchild, and my oldest just got home from Penn State for break, so I am beaming. Sorry. Very excited to have her home. She also brought home about 6 bags of laundry, but that's okay. I'll take it. So real quick, I mentioned the health update for the 5 schools that really, they're seeing all similar issues, respiratory infections probably being the biggest thing. Couple events, in regard to health that took place over the month of November. We had our annual Radnor Township Thanksgiving basket drive, which is, when they ask for non-perishable food items as well as gift cards for families that are in need so that they can have healthy meals and enjoy the holiday. We're somewhere around 160 families, believe it or not, that are in need currently. The high school hosted its annual Thanksgiving dinner again. This is a yearly event, takes place in the cafeteria. We always invite the Wayne senior citizens, and this year we added our retired teachers to the list, which was lovely to make those connections between everyone. The food was donated by our families, and so many students were there to help set up and serve and clean. It was wonderful for the seniors because we all know that socialization helps so much, with their mental health and their affect and mood and all those good things. So it was lovely to have them, as we always do. The high school also hosted a Speak Up event. I'm not sure if you're familiar with Speak Up, but it's an opportunity for different stakeholders in the community, whether it's teachers, administrators, students, parents, teachers. They all come together and discuss different issues that are affecting students. So Chloe, I'm not sure if you were there that night, if you could speak to this, but I know some of the topics were stress and mental health, healthy relationships, the impact of social media, race and racism. And that is always an absolutely fantastic event. The candor that comes from those conversations and the follow-up that comes is just always a wonderful thing. Wayne Elementary had their annual 5K run walk, annual running bee, they call it. It took place on Saturday, November 18th in efforts to promote a healthy lifestyle and healthy habits. And they had a wonderful turnout. We have our therapy talks back in all the buildings, which the kids always love. So they are back and helping with social emotional health. And we all know this time of the year, especially for our students, can be extremely stressful over the holiday season. And then finally, Ithan Elementary had families and volunteers come together to help support a food drive that delivered over 15 boxes of food to the Wayne Pantry to help those in need. And that's it.
You raised the issue of stress, and it kind of pinged me a little bit. You can't read the medical literature on pandemic without seeing an immense amount of work and assertion about the significant adverse effects, not only of the pandemic itself, but of the isolation that was a part of the way we managed it. So you have a kind of an aliquot of students moving through. Is there anything that we are doing to I guess it's would be hard to do to specifically track the post-pandemic effects? I mean, I would think it would be somewhat different for those who were in their grade school years than from those in the middle than from those in high school, what you might see. And I guess as I work this through, it's probably an untenable notion, but of trying to track what the adverse effects of the pandemic are as they work their way through our schools.
So I think I mentioned this last month. I mean, we base our supports on data, right? And we're always looking at data to show where we need to, put additional supports or take away supports, depending upon what the data tells us. We look at student referrals in terms of our students assistance team. We look at attendance, we look at grades, we look at lots of different data points to make sure that we're covering our bases with our students. And I mentioned this before as well, not to sound like a broken wheel, but we are so blessed in Radnor Township to have so many supports, especially in our schools. It's truly incredible, the stuff that we have for our students.
Thanks. So no action items for us out of that. I really appreciate your keeping us connected and up to date on what's going on in the school board. And the other that I put here for new business was in case there was anything on the Cray Tom, so we've already gone through that. So I think we're done with new business, and let's fold back and take care of old business. And start with you, Alex, on the Severance Sisters lecture program.
Yes, so we actually just today finalized the flyer that we're going to use to both promote the event and also collect registrations. Again, we're collecting registrations just because we're anticipating that this could turn out to be a highly attended event, and we want to make sure that we're staying within the limits of the fire code for the building. So I will be sending that out immediately after this meeting. We're obviously encouraging everybody to, circulate this, as widely as possible. Certainly we would love to see school students attend, but, we're also being mindful of the other communities outside of the school, whether it's the college students or, families who might have students either in private school or homeschool, business owners in the community who maybe don't live in the community. There's, we're trying to keep all those different stakeholders in mind, in addition to, of course, the public school students who we traditionally think of as our, Radnor student population. So we have that. I just want to see if I
remind me, Alex, the date.
It's so it's going to be the 16th. It's going to be following our regularly scheduled meeting, which I did want to make one point about that. I didn't think about this when we initially scheduled it, but I did want to see if we could add some time sort of toward the end of the agenda for myself and Kiki to kind of introduce the event. A little bit because we've never done it before, but also because since public comment is usually the last thing scheduled on our agenda, if we have all these people showing up for this other thing and then we announce public comment, we may get a bunch of people who are all coming up to talk about this, and really not that, of course they're welcome to do that if they want to, but really the purpose of the event is not to, have 100 people come and make public comment at our meeting. So just kind of clarify a little bit for people that, that's a separate meeting. And also I'm sure Kiki's going to want to introduce the event. This is, something that's obviously very close to her heart for a number of reasons. And so I did just want to ask.
Sorry, there's no reason why you couldn't pick up the agenda again prior to public participation. And characterize the meeting as it comes, and also, remind people, give a little bit of a characterization about what public participation is, because yeah, I agree completely. I think that contextualizing it makes perfect sense.
Okay. So yeah, so some of those invites have started to go out, and then, like I said, I'm going to send everybody the flyer immediately following this meeting now that it's been finalized.
Excellent. So that ties into the next item on the agenda, which I just put in Board of Health lecture series. I think that I'm really thrilled that this is going to come off, this Savage Sisters lecture, as a sponsored is not exactly, but as a sponsored program coming to the township as a consequence of the efforts of this board and Savage Sisters, but through the efforts of the board. And two things come to mind. One was that when I first started, it was not at all uncommon for the members of the board to give a 10 or 15-minute talk as part of the stated meetings during the course of the year in areas of their expertise that might be relevant to township health. And so I just, since we don't have that many folks here, it may be whistling in the dark, but I think that we could do two things based off of the efforts that you put in, and that is consider the Savage Sisters thing a pilot for future public lectures that might come up, and keep in our minds when we have guests or issues that this is something that we can do. We can learn from this one, and we can incorporate it into the things that we do, and consider reinvigorating the piece of having the members of the board give a talk. It's a little bit of showing off, and a little bit of give people in the community, should they care to watch, a sense of the skills and talents the people who volunteer to serve on this board. So I just kind of wanted to raise that, keep it in mind. And then next month, when we're face to face and hopefully we have more folks, I'll raise that again. So that's all that was. And Bob's not here, so the oral health program, we can kick that can down the road. And
I actually just heard from him. He's in Hawaii, so I'm sure he's very upset to not be here.
Poor guy. and if there's nobody else that has we lost Lisa, but she's coming back. If there's nobody else that has a comment on old business, then I'm going to turn it over to Lisa, Chloe, and Julie to cover off on the monthly update on the intern program.
I just wanted to make one comment really quickly because I know we sort of bounced between new and old business, but one thing I did just want to kind of make people aware of is the Biden administration announced, I think just within the past week, that they are taking a look at what would be a major kind of upending of the drug pricing structure in this company, specifically that they may do some basically seizures of patents. Around this policy, they have scheduled a public comment period. The public comment form has not officially gone up yet, but it is something that I wanted to put on people's radar because I think it has the potential to be a very significant change. And so if that's something that people want to comment on one way or the other, that's something that I think people should be aware of.
It's a really excellent call out. Let's see what hits the streets from the administration and decide whether we need to do that in an organized way, whether we will need to ask somebody for a presentation or whether ad hoc discussions will be adequate, and public awareness is our role. So thank you, Alex. It's a really good point. Thanks. Anybody else before we go off of old and new business? And if not, then I turn it over to Lisa, Chloe, and Julie.
Hi. So I think Lisa was at the last meeting and discussed a little bit maybe about what we had met with Chloe. And it seemed like Chloe's interest was in going deeper into understanding the implications of lack of sleep on students' health. And I think, Chloe, if you want to talk about, what you came up with over the past couple weeks, go ahead.
Thank you. So what I've been doing is that the final findings from the 2019 RHS sleep study, which was provided to me by Mrs. Kevgis, documented that the majority of students feel they're not getting enough sleep and that the quality of their sleep is poor. And the students also reported that they have been experiencing elevations in negative mood and anxiety, which may be related to the sleep deprivation they've been experiencing. And due to the high percentage of students surveyed in the sleep study reporting these negative mood symptoms, it is important to explore the relationship between sleep and mental health amongst adolescents. So the goal of my research would be to establish the strength and direction of the relationship between sleep and mental health by completing a survey amongst the students in grades 9 to 12 at RHS, and then to develop a practical interventions to increase sleep and thereby have a positive impact on mood and or anxiety, and to distribute this information to administration and counselors that work with students and utilize these interventions and with the students that are expressing and are experiencing poor health and or mental health concerns. And then I have a brief timeline that I could share. So I would have like a final selection of reliable or valid surveys by the end of December, and then I would like to have present it to Dr. Mack and the school board by the beginning of January. And that would probably be approved by beginning to mid-February, just depending where the board meeting lands. And then possibly administer it late February, early March. And then use this data to develop interventions by April.
So Chloe,
Comment on that?
time I'd love to be able to sit down, with you and the others to just kind of map some of this out and discuss some of the logistics about this, because it is, timing is tricky and it takes a little bit longer sometimes than we hope. So yeah.
Thank you.
Well, thanks for that, PT, because my comment was going to be, wow. I'm astounded at how aggressive the timeline you've said it is, and B, I think it's a worthy endeavor. You bit an awful lot. I mean, it's an awful lot. So I wouldn't hesitate to, as you get into this, take the broader topic and focus it down on if you can handle it, hooray. But you may find that it's an awful lot and that you'll need to cone it down, and you have excellent mentors and PT kicking in to help. I'm looking forward to this, and thank you for your clear articulation of where you've gone on this.
Thank you.
Lisa, anything on your side? You're muted.
You think I know how to do this by now. So Finn and I, basically we've been kind of making some contacts at the township just to see if there's any official, number of bike racks or location, if there's, kind of record of that. To be honest, we're kind of getting sent to different people. So it makes me think that there isn't an official record. Before he goes out and kind of does his in-person assessment. The other thing is that we're looking into maybe
Did we just lose Lisa?
kind of making recommendations. Yeah.
Lisa, you're going in and out.
Can you guys hear me? Yeah, I got a phone call while I think it was because I got a phone call and then
okay. Yeah, now I can hear you.
Okay, so sorry, I'll briefly say what I said before. We're trying to see if there's official information with Parks and Rec regarding locations of bike racks before he goes out and does an assessment. And then we were thinking about, or he was thinking about broadening it a little bit and getting a little bit information about bike share programs, and maybe looking into what would be necessary to institute something like that in Radnor, and if it would be helpful. So kind of taking it from the micro and making it a little bit more macro, but without, extending to the heavens and including everything everywhere.
You feel as though you're on target and have what you need to continue to move forward?
Yes, absolutely.
Great. Anybody else want to weigh in? Thanks, guys. Thanks for all your efforts and thanks for the updates. And that brings us to public participation. And Ian informs me that there are 2 attendees in public participation, and one has expressed the desire to make a comment. So Ian, I hope you can hear me, and we can link the folks who want to. I can see the names coming up already. Great, thanks, Ian. Christy Parry, I see your name up, and you had expressed a desire to make some comments in the public participation portion of our meeting. So the floor is yours.
Okay, can you hear me?
We can.
Yes.
I can. Yeah.
Can you see me? Because I can't.
I can't see you. Have you clicked to share video?
That's fine. Well, it's been an interesting meeting. Yeah. I just like to know, I'm not real familiar with the Board of Health and all your policies or what you focus on, but I'd like to know if the Board of Health addresses or plans to address the chronic disease epidemic in children and adults. We're very sick. And the new mRNA vaccines are being found to negatively reprogram the innate and adaptive immune systems. So they're adding to the problem. Epidemiologists are also finding patterns in data from different countries that validate each other. One pattern being a strong relationship between when the mRNA vaccine was injected and the timing of acute sudden death. So we have an epidemic of chronic disease that in children has risen in sync with the rise of the number of vaccines given since 1986, when all liability was removed from the pharmaceutical companies. And since 2021, we have an alarming new epidemic of excess mortality across all age groups that coincides with the COVID vaccine. So my hope is that we can focus less attention on, in the future, on vaccine solutions for infectious disease and more attention on policies that help to strengthen our immune systems to lessen chronic disease.
So Christy, I am going to speak now. That is completely out of the purview of the Radnor Township Board of Health.
So you're infectious disease, but not chronic disease.
We do not deal with chronic disease management, and it's really not a. This is not a forum for debating federal level policies or quite frankly, any of the topics that you raise. This really is not the forum for that.
So I'm just curious, and okay, so who determined that you focus on infectious disease and not chronic? Like who would I turn to talk about chronic disease and where we can get help with that?
You could go to any of the established places where that are responsible for public health. We're really responsible to provide advice to the Radnor Township Board of Commissioners on issues related to health in Radnor Township, and it's beyond our resources and beyond our capabilities to deal with the array of public health chronic disease management.
Okay. Well, I enjoyed the meeting anyway. Thank you.
Well, thanks for joining us. Ian, is there anybody else in the queue for public participation? In the absence of a comment, I'll take that as a no. Since we really didn't officially convene because we don't have a quorum, I don't think we need a motion to adjourn the meeting. Thank everybody for your participation, all the efforts that everybody's putting in, and I'll look forward to seeing everybody on January 16th with some communications to follow between now and then. Any other comments or issues that people want to raise before we close this out, other than Merry Christmas, Happy Hanukkah, Happy Kwanzaa, and Happy Holidays to any of the holidays that I haven't included, and a joyous season in the dark that seems to be a season of light in the celebrations.
Just very quickly, because Chloe, I know you weren't on for the beginning of the meeting. What David's referring to is that next month our meeting also will not be at the regularly scheduled January or third Monday of the month time. Next month it's going to be on Tuesday. And that happens relatively frequently. So we're going to try to get everybody, informed about that ahead of time, but just kind of keep an eye on that'll probably happen a couple more times while you're here.
Well, do we know if it'll be in person or on Zoom yet?
We try and meet in person regularly.
It will be.
Zoom was a special escape because good.
Yeah, I think it should be in person. I don't think this thing of having a kind of last minute move to Zoom, that doesn't happen very often. That was more of a rare thing.
No,
what happens more often.
I'll interrupt. We Zoomed tonight because it was a solution that we were backed up. our 5:30 to 6:30 was backed up on the Board of Commissioners meeting, which would have meant we would have had to finish early if we met in person or choose another date. I think choosing another date for the people on the board is really, really difficult. They set these up in advance. And so Peggy suggested that we could set up a Zoom, and that's why we did this. We did do a lot of Zooming during pandemic, but we are in person unless otherwise stated for the future.
Thank you.
Thank you. Anything else? All right, with that, I'll let you folks.
Holiday.
Happy holidays, everybody. Bye, Julie. Bye, PT. Bye, Chloe. Bye, Lisa. Bye, Alex.
Happy holidays, everybody. Happy New Year.
Happy New Year. Bye.
Bye.